So we're going to start with assessing the 5 cardiac landmarks. First we'll start with palpating them. First one is the aortic, which is in the second intercostal space on the right side of the sternum. The pulmonic is on the left side of the sternum in the second intercostal space. Erb's point is in the third intercostal space. The tricuspid is in the fourth intercostal space. And the mitral is in the fifth intercostal space and along the midclavian line. Alright, the bell of the stethoscope is used for low-pitched sounds, such as extra heart sounds or vascular sounds or brutes. The diaphragm of the stethoscope is used for high-pitched sounds, such as breath, bowel, and normal heart sounds. The bell is pressed lightly against the patient's skin, while the diaphragm is placed firmly against the patient's skin between the middle and index finger. Now oscillate the cardiac landmarks. Alright, after that you can assess the color of the skin. The skin should be uniform in color around the entire body, besides possible places that have extra vasculature that may appear pinker or redder. Common abnormalities are jaundice, pallor, and cyanosis. Next you assess the temperature of the skin with the dorsal side of your hands, and it should be warm. Pulses are then taken. Pulses should be normal, regular, and equal bilaterally. So you can start with the radial pulse, and then the brachial pulse, and the posterior tibial, and the dorsalis pedis. The last thing to inspect are the nail and the nail beds. You inspect and palpate the nails for shape, contour, consistency, color, and thickness and cleanliness. Edges should be smooth and round. Surfaces should be flat in the center and slightly curved downward at the edges. Nails should be clean, and the skin adjacent to the nails should be intact. The angle of the nail bed should be 160 degrees, and the nail bed should be pink and are yellow or brown and darker pigmented skin. To assess the capillary refill, squeeze the patient's nail bed, and once you see blanching, relieve pressure and notice refill. This should take no longer than 3 seconds.